Where do I begin? So, I was going to explain to my people what I'm going through, and that's what I'm going to do. So, I was going through something this past couple weeks, so I haven't been making any videos. I haven't really been doing too much here recently, but basically I've been focusing on my health and focusing on me, focus on what I gotta do. It's been an up and down journey. It's been up and down. As you notice, the right side of my face, this is my right side, so you may be looking at the left, but this is the right side of my face. And I started having symptoms a couple of weeks ago with my headaches. And, of course, there was a viral infection going around. Most people may have symptoms of bronchitis. If you remember when COVID was going on, a lot of people may have COVID symptoms. I was having some bronchitis and I was having some issues coughing. I also had like some sinusitis going on, which is also a viral infection. And then I started having, when you have sinusitis or whatnot, you start to also have, drainage. And I feel a lot of it in my ears. Well, I missed work Thursday, Friday, and they took me off today. I have my paperwork here, and I'm going to explain to you, according to the paperwork, on what I got diagnosed with. So, right now, I'm talking to y'all out the side of my mouth because nothing is going to stop me from creating some kind of content. So, here we go. Bell's palsy is caused by damage to or inflammation of the nerve in your face. It is unclear why this happens, but an infection by a virus may lead to it. Most of the time, the reason it happens is unknown. These are the signs and symptoms. Signs and symptoms can range from mild to severe. They said I have a mild case because when I'm not talking or I'm not eating or drinking or anything, you can't really tell. But right now you can tell, like everything's pulling over here. But when I'm looking straight like this, I look fine. I look normal. But like if I close my eyes, like this one don't close all the way, if you notice. It was real bad yesterday, so like I can't blink and it doesn't close all the way. So this side I could still feel, I could still all that. It's just not wanting to move. I feel like somebody smacked the shit out of me spiritually. I can't wait to get over there and show out. Don't make me laugh from the side of my mouth, girl. But here is the signs and symptoms of Bell's palsy. Being able to raise one or both eyebrows, close one or both eyes, being unable to, feel parts of your face, facial numbness, and that's all three of what I felt. The day before yesterday, I woke up and I was kind of numb on this side. Now, I have nerve damage. I have other underlying issues that cause that sometimes, and so I was thinking, the feeling will come back. I didn't have any other problems until that night I went to bed. I started to, my ears started to hurt really bad. And then I was getting numb again. I'm like, what is going on? Yesterday, I got up, take my sister to work and get the baby ready. I couldn't smile. I was like this. This side of my face was not going. And I was like, oh, shoot. This can't happen. This cannot happen. And, I like the side of my tongue is even numb. Things do taste different. So, let me continue on with these signs and symptoms, though. Drooping of the eyelid and corner of the mouth, which is what I got going on right now. It's not drooping, it's just shit ain't working. Weakness in the face, paralysis of half of the face, loss of taste, sensitivity to loud noises. To everybody in the house talk loud. At this point, I just have a low tolerance of talking. But here I am. Difficulty chewing. I've been having that. I could barely drink. Tearing up in the affected eye. Dryness in the affected eye. Drooling, pain behind one ear, which I've had all those symptoms. Diagnosis of Bell's palsy may include a medical history and physical exam, an MRI, a CT scan, an EMG. I don't know the full word. It pronounced the whole word, but it's an EMG. This is a test that checks how your nerves are working. You know what? I went to the emergency room and they checked my blood pressure. Well, actually, at first I went to the urgent care. They checked my blood pressure. My blood pressure was good. It was like, I think it was like 180/89, which was fine. And then they sent me to the emergency room. I didn't want to go to the emergency room, but I ended up going to the emergency room yesterday. They didn't do none of these. So I'm definitely looking at going back if this shit don't work. But they didn't do these. So I may have to, I gotta go to my regular doctor. But they didn't do none of this shit. Treatment may include antiviral medication to help shorten the length of the condition. Sometimes treatment is not needed and the symptoms go away on their own. Baby, I'm gonna need this treatment. They did prescribe me some antiviral medicine, which is a big ass horse pill. You know, the crazy thing is you can't swallow, but they give you a horse pill, which is pills that are this big. And then they gave me some steroids for the inflammation as well, which I was up all night. I took my first dose as soon as we got to my grandparents' house because they didn't want me to drive. Let's see. Home care instructions. Take medicines only as directed by your healthcare provider. Do facial exercises and exercises and direct by your healthcare provider. If your eyes is affected, use moisturizing eye drops to prevent drying your eyes and drying of the eyes. And use direct by your health provider. Protect your eye as directed by your healthcare provider. Seek medical care if the symptoms do not get better or get worse. You are drooling. Your eye is red, irritated, or hurts. Seek immediate medical care if another part of your body feels weak or numb. You have difficulty swallowing. You have a fever along with symptoms of Bell's palsy. You develop neck pain. I thought they thought I was having a seizure, so I did the basics. This is the basics of your motor skills, okay? Whenever you go to a neurologist, when you go to a psychiatrist that gives you medicine that can affect your nerves, they have you do stuff like this, okay? And they have other basic treatments. I'm not going to do that right now because I'm like, it's too much to talk about. But I was making sure that I wasn't having a seizure. And so everything else is fine on me. My arms, my legs, the rest of my body. It's just my face. And as far as like my neck and everything goes, I can swallow regular. I just can't hold it. Like if I try to blow up my cheeks, I'm leaking out. All right, the next part says, make sure you understand the instructions. We'll watch your condition. We'll get help right away if you are not doing well or getting worse. This information is not intended to replace advice given to you by your healthcare provider. Make sure you discuss any questions you have with your healthcare provider, which means just because I'm explaining what I'm going through, that don't mean diagnose yourself at home, okay? Go to the doctor, okay? Go to the doctor. This is just my work excuse and all that stuff like that. Bell's palsy. It is a common condition and most people recover completely. Risk factors. Risk factors of Bell's palsy include pregnancy, diabetes, an infection by virus, such as infections that cause cold sores. Now, I am prone to cold sweats because I am one of those people that have autoimmune diseases, okay? These are not contagious diseases. These are just stuff that I was born with. Thanks, parents. I do have type 2 diabetes. I ended up getting diagnosed with type 1 as of a year and a half. Wait, no, it's 2025, so it's 2 years ago. So I have type 1 and 2. Figures, right? And I'm not pregnant, so, you know, that is what it is. Let's see, causes. Yeah, that's all the information about it. That's all the information I got on Bell's palsy over here. Yeah, this is all my paperwork. So, yeah, it's been a couple of days. I've, you know, since the summer started, since the summer begun, I've had, you know, up and down issues with my health, with my asthma, my legs, and everything like that. And so I've been trying to keep myself like moving in my face and all this stuff. I'm still keeping myself moisturized and beautiful, honey. You know, this hair don't stop in the show. One monkey don't stop no show. Okay? Just because I'm talking out the other side, that don't mean I can't speak. So, anyway, we still gonna get into some topics because they took me off of work yesterday and today. So our first day back is tomorrow. I didn't want to miss no work, but I missed some work, which sucks. So I did post a video of my first day dealing with well, it wasn't my first day dealing with the Bell's palsy, obviously. It was just my second day, and it was my first day being released from the ER, which I wasn't in there long. Like I said, they didn't do EMG, MRI. They didn't do none of those tests. They checked my blood pressure, asked me some questions, felt my face. I described everything to the T of what I've been going through, and I was diagnosed. But if you are concerned that you're going through this and, you know, this could lead to long-term if you're not taken care of. So I will say, go to the doctor, request the testing, do what you got to do. Because what's going to happen is if you don't take care of yourself on time, you know, it could be long-term effects. Especially if you already have nerve problems. Especially if you're already on nerve medication. So, definitely look into that. But, yeah, I'm talking out the side of my face right now. And I'm still cute. Don't worry about it. Don't worry about it.